Good morning, everyone. My name is Luigi Boggian, and I just finished my PhD in economics at UCLouvain. I was affiliated to IRES and IRS. My PhD thesis mostly investigated inequalities in healthcare access between immigrants and natives, trying to understand the patterns of foregone care between immigrants and natives, and also prescription data from administrative sources. My thesis is divided into 3 chapters, and in the first chapter I study inequalities in unmet needs for care between immigrants and natives in 14 European countries by using some survey data. In particular, I was using the survey called SHARE, the Survey of Health, Aging and Retirement in Europe. What I find in my analysis is that immigrants are more likely than natives to forego care, and my results are actually robust to the inclusion of a number of needs and socioeconomic controls. Interestingly, when investigating the potential explanatory channels for these inequalities, I find that language barriers and insurance, the access to insurance, are actually important factors that can help explaining these differentials. My second chapter investigated inequalities in prescriptions for 2 important cardiovascular risk factors, diabetes and hypertension. In analysis, I used some data, some administrative data provided by the Spanish Health Ministry, and what I find in my analysis is that immigrants, for both groups of drugs, antihypertensive drugs and diabetic drugs, immigrants are less likely than native to be given these medications, in particular when they have very high levels of needs. In order to control for needs, I not only used information on the diagnosis and information on the previous use of this medication, but I also used biometric data, that is to say, measures of the glycated hemoglobin, the biomarker used to measure diabetes, and also blood pressure measurements. Finally, in the last chapter of my thesis, I investigate mental health treatment inequalities, and in particular with respect to 2 specific conditions, depression and anxiety. What I find in my results is that immigrants are less likely to be given these medications even when they have high levels of needs. The way I was controlling for levels of needs is through an index for comorbidities and also through the diagnosis for specific mental health conditions. Interestingly, my results are also robust to the inclusion of a number of space and time-specific factors, and in particular also when I control for the weather, vector. In general, my thesis shows that there exist important systemic barriers in healthcare access for immigrants in Europe, and in particular in Spain, the country that I investigated the most in my thesis. These systemic barriers exist both on the supply side and on the demand side of the healthcare market. And future research should actually focus on disentangling these 2 important aspects. Right now, I'm a postdoc researcher at the University of Verona in Italy, where I'm working on a Horizon Europe project called FLASH that investigates the flexibility of healthcare systems in Europe. I am specifically working on financial and non-financial incentives in primary care using some administrative data from the Veneto region. I thank you all for watching.